Hi everyone, it's Julie Ka'anapu with Pro Health Share. What I wanted to share with you today is one simple thing you can do to decrease heart disease up to 60% and all types of cancer fourfold. What's that simple thing? Having optimal vitamin D levels. See, it's been claimed that vitamin D deficiency is an epidemic not only in the US but around the globe. We're just not getting in the sun as we used to. We're at work, we're inside under fluorescent lights, and when we do go out in the sun, we're slathering on the sunscreen. So why is vitamin D so important? Well, one, it can help with moods and make you feel better, but it does two really important things when it comes to prevention. One, it has an apoptotic effect, and two, an anti-angiogenic effect. So what does that mean? Well, apoptotic or apoptosis means cell death. So for an example, let's use cancer cells and abnormal cells. Vitamin D can actually cause cell death. Anti-angiogenic effect, what does that mean? It prohibits the spread of cancer, if we're using that for an example. And if you're like most people, we think of cancer as this abnormal cell growth, right, that kind of slowly grows like the blob throughout our body. And actually, cancer is really smart. The way it spreads or grows is it sends a signal to the brain that says, I'm hungry, I need energy, I need a source of food. And the brain hears that signal and says, there's something in my body that needs growth or an energy source. So it sends capillaries to the cancer cell, and then you've got it. Cancer cell has access more throughout the body to be able to spread and use those capillaries as not only an energy source, but a way to spread throughout the body. So having an anti-angiogenic effect, it is able to inhibit that signal from the cancer cell to the brain for capillaries to grow towards it in order to spread throughout the body. So the last thing is, I said optimal vitamin D levels. What does that mean? Now this is where it can be confusing because lab to labs, their values or their normal expected ranges can be different. So who's right? However, when it comes to vitamin D, most lab levels will show a normal range anywhere between 30 to 100. So if you're at 32, 33, do you need vitamin D or are you considered normal? Absolutely, your vitamin D levels are normal. However, they're not optimal. See, if you're a woman and your vitamin D levels are even below 35, which is normal, you have an increased risk of breast cancer up to 60%. So vitamin D is very important to be on the upper range of normal, on the right side of the bell curve. So do yourself a favor, please go get your vitamin D levels checked. Talk to your doctor about optimal vitamin D levels, not just normal. If you think this was helpful, please like below or share it with someone you love to help prevent diseases and be preventative in our health. Thank you so much for watching. Talk to you soon.